DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. We're at the University of Nebraska in Lincoln. We have Dr. Dave Stefan. We're going to talk about pathology in cattle, inherited diseases, and much more. We're glad you joined us. Stay tuned.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here with a friend and colleague, Dr. Dave Stefan. Dr. Stefan is a pathologist here, diagnostic pathologist here at the University of Nebraska's Veterinary Diagnostic Lab, and been at this a little bit.
Yeah, I've been working in diagnostic labs since about 1988. Been working on inherited and birth defects in cattle for all of those 35 years.
Yeah. And so you've seen a lot of cases and a lot of different things within our industry in that time. But, kind of talk about the process of, what are the services that you provide and things when people think they have an issue, kind of what do they do?
Yeah, I work as a general diagnostic pathologist, so I do all kinds of cases on all kinds of species, but I really focus my research on cattle, particularly perinatal issues. So I investigate a lot of birth defects in cattle, but also diseases that maybe aren't present at birth, and we'll talk about one of those later, that are inherited, but they might develop clinical symptoms later. Mm-hmm. And I have contacts with the major breed associations, Hereford, Angus, Simmental, Red Angus, and I've worked with a variety of them over the years. And I'm kind of their go-to person if there's a product complaint where somebody sold a sire and they're throwing bad calves or abnormal calves. Some of the things the breed association staff know, and they'll deal with it. And if it's something that's kind of beyond them, they'll refer questions to me. So I get approached with questions from emails from the breed associations, phone calls, and sometimes we'll get samples.
Obviously, there's disease processes that are, that we acquire from bugs, and then there are things that are inherited. Do you generally work through a veterinarian with the sample when they submit?
Yeah, the majority of the cases, I guess there's kind of a split, but just about the vast majority do get referred to a veterinarian. I think the initial point of contact is the concerned animal breeder has a complaint. Sometimes they'll go to a veterinarian first, and the veterinarian's like, might be genetic. A lot of times the breeders will just contact the association as a first point of contact. And then it depends, even if they're going to send me the whole calf, a lot of times they go through a veterinarian to get that accomplished. It depends on what the disease is, what the signs are, and where they're located on how we handle it. If it's a disease I'm actively researching and I need the whole calf, we'll pay to get the whole calf shipped here. Sometimes, we've bought in live cows and brought them here for sampling. Sometimes if they're by a regional diagnostic lab, if they're 2 hours away from Manhattan, Kansas, we might send them to K-State. We've just done a blindness research project where we had calves looked at by ophthalmologists in Georgia and Missouri and Wisconsin. And I'm working on a polydactyly project where we've had calves coming from California. So they come from all over. I really like now with the digital technology because a vet can call me out at the ranch with their cell phone. I'm like, why don't you hang up and snap a picture or a short video of it and send it to me? I'll watch for it right away, and then I'll get back to you on how we want to approach the sampling. So it kind of goes that way.
So either the veterinarian helping you or the diagnostic lab saves having to bring the animal from California to you. you can work with them and just get the samples that you need.
Yeah, and it depends a lot. Sometimes you get a picture of a black calf and you can't tell anything from it, so you need the whole calf. Sometimes it's a specific disease, and for this specific disease, we need this set of tissues. We're working on a Hydrops thing in Simmentals right now, and at first we had a list of tissues we needed, and it was really hard to get that from these complicated pregnancies, so we ended up buying a couple pregnant affected cows and bringing them here, and we harvested one in the meat lab. The other one had an antibiotic withdrawal issue, so we harvested it in the diagnostic lab.
Perfect.
But there's a whole variety of things. Like some of the blind cattle, we sent them to a vet school to look at the eyes, and then we discuss sampling from there.
Perfect. We're going to take a break. When we come back, more with Dr. Dave Stefan here at the University of Nebraska. Hey folks, welcome to Cattle Intel by Neogen. And today we're talking again about biosecurity. And one of the big practices of biosecurity is introduction of new animals to your herd. If you have a closed herd and you're going to bring new animals in, it's best to isolate those animals and quarantine them for at least 30 days. The reason why we isolate and quarantine for 30 days is because most disease processes will be cleared within 30 days. If you want to use diagnostics to test for certain diseases like BVD, you can do that, which will speed the quarantine process up, allowing you to make herd introductions. But isolation and quarantine is a great practice for biosecurity. Thanks for joining us on Cattle Intel, sponsored by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igneity Feeder. Igneity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igneity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igneity Feeder.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism, then bite back at safeguardworks.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Dave Stefan, and we're at the University of Nebraska at Lincoln, where Dr. Stefan serves as a pathologist in the veterinary diagnostic lab and sees all kinds of cases from cattle and other animals, but his real focus has been on beef cattle and bovines. Kind of talk, through some of the things that you do or things that you see on a general basis.
Yeah, when I get a point of contact or somebody has a concern about an animal, I'm working this morning on some cases where these calves were born with really large hearts and they're in a crossbred herd, and then it's like, well, what's causing the large heart? And we get samples sent to the lab and we look at it. With that particular disease, I don't know of any virus that would cause that, but we save samples from the hearts and to collect DNA from them. And just this last week, they went out and sampled the bulls, so we can see if these calves with large hearts all came from one sire or not. Because if they're from different sires, we then it's probably not genetic, it's an environmental thing. And a lot of the things I look at are environmental. Sometimes we can detect a virus or evidence of a virus in the herd or in the samples that gives us a cause. Sometimes they're just kind of one-off things. And with technology the way it is today and the less cost to go after some of these things, there's a growing list of genetic defects that are like one-off mutations in that particular calf. It didn't come from the sire of the dam. It occurred in the early embryo of that calf that we're figuring out, and that's what some of these kind of freak calves are. But we look at for a pattern of occurrence, and that's why centralized reporting through the breed association is important, because if in one herd, they might only have one case, but across the country, there might be 7 cases. And then when we start looking at them, they all end up being pedigreed to a common ancestor or something. And then that's kind of a red flag that we need to start looking at things closer.
Yeah, I can see where we would have one specific case on a farm, and we get concerned about it, but then understanding that it can happen after conception, during embryonic development, that maybe is an inherited disease. We probably couldn't have done that a long time ago.
Yeah, we would have never recognized without a pattern there to give us a hint, we wouldn't know whether it's a mutation, and we couldn't sequence it. It was too expensive. We wouldn't know if it was an individual mutation or something environmental that happened. And the problem with the environmental things that we deal with, some of them have been characterized and reproduced experimentally, but a lot of them, they happen early enough in gestation that there's no record of what happened to that cow at 80 days gestation or whatever. It was out in the grass, and if it got sick or got exposed to something, you can't ever track that down.
Yeah, even some of the environmental things like heat stress and cold stress and some of those things, do those have an impact potentially on that embryonic development?
Yeah, I have an old book from the 1970s that was published where they have a whole list of teratogens, but environmental things that can cause birth defects in animals, and there's a lot of lab animal stuff in there, and some stuff as generally innocuous as a high fever in the dam can cause serious birth defects if it happens just at the right stage of embryonic development. So all of those kind of things we miss.
No, it's incredible. It's incredible science. We have the world's expert here with us today. We're going to take a break. When we come back, we'll talk with Dr. Dave Stefan about some of the projects that he has going on in his research laboratory here at the University of Nebraska. Thanks for watching DocTalk.
Plant the seeds of financial security today with United Patriot Coins Precious Metal Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed Lido Band, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. Lido Band, a small device that can make a big difference.
Ranchers, looking to elevate your pasture management game? Turn to Hein Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Hein Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson with Dr. Dave Stefan, and we're here in Lincoln, Nebraska at the University of Nebraska at the Veterinary Diagnostic Lab, where Dr. Stefan serves as a general pathologist here in the Veterinary Diagnostic Laboratory, but he's also a world's expert in inheritable diseases and mutation in cattle. And we were talking about cases that you have seen, and the one of them is this blindness issue in Herefords.
Yeah, we've recently published just this last month a paper on, we called it delayed blindness in Hereford cattle because they're born sighted. The original herd didn't notice any problem with the cows until they brought them in at about 18 months of age, and they noticed one of them was blind, and then they noticed the other one was showing signs later. And looking at those cattle, they were both closely related, I'm not an eye specialist, so I referred them to a ophthalmologist that was close to where the herd was located, and they looked at the eye and they noticed the back of the eye was hyper-reflective. It's something you can't see by looking at the cow externally, but when you look at the cow, a trained ophthalmologist can tell there's a hyper-reflective retina in the back of the eye. So they were both confirmed blind, and then we looked at the pedigree, and both the cows had a common ancestor in the pedigree on the top, on the sire side, and what we call the bottom, the dam side of the pedigree. And when we have that, that creates at least a mechanism. If that common ancestor had a variant allele that caused blindness, they could have inherited it and be as a recessive trait and be affected. So when we see that, it's like two animals that could be coincidental in the one herd. So we kind of worked with the Hereford Association to get the word out among select breeders that were fairly active in that line of cattle to look for other reports of blindness. And over the next 18 months, we ended up having approximately 8 blind cattle reported to us. We referred several of those to different ophthalmologists around the country that were closest to the ranch to take a look at the retinas and verified that they were blind. And they all had that same common ancestor top and bottom of their pedigree. So we're pretty sure it was a recessive trait. And with that information, we applied for funding from the Hereford Association so that we could do sequencing. So we sequenced all those blind cattle that were originally reported. We sequenced the sires of those cattle, the dams of those cattle, and then as we could up to that first foundation sire, up the pedigree, we tried to verify the genotype, and we look at the genotype to see if we can find a variant somewhere in the genome that's homozygous in the affected calves, heterozygous in the parents, and non-existent in other family lines in the breed. And there's huge databases now of published sequences. We have some of our own from various other projects. There's University of Missouri has a guy that shares his data with us that we can check there. So when we find a candidate gene, we can kind of make sure it's limited to that line, and then we look at the effect. And with this particular gene in the Herefords, it turns out the gene that was variant, we also look at that sequence. In that sequence, the nucleotide change caused a stop codon, so that protein gets truncated and not produced effectively. And looking in the human medical literature, so I have books on human pathology in my office, so when I have a weird calf, I compare to if there's something like that weird in babies, and maybe that'll give us a clue. But in this case, there's like 13 different variants in that gene in people that cause blindness, and it's a delayed blindness in people too. It might be 3 or 4 years old for some of the mutations, and other ones it's in their 20s and 30s where they go blind, but it's a real similar type of disease.
It's amazing. It's an amazing case. Dr. Steffen gets some very interesting things to work on, a lot more interesting than things I get to work on. But let's take a break, and when we come back, we'll talk more with Dr. Dave Stefan here at the University of Nebraska. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so Alertus test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Dave Stefan. We're in Lincoln, Nebraska at the University of Nebraska at the Veterinary Diagnostic Lab, where Dr. Stefan serves as a general pathologist here at the D-Lab, but also is a world-renowned expert in bovine diseases and inherited diseases, to be more specific. We've talked about the Hereford case. You have another one that's ongoing in Simmental breed.
Yeah, right now we're in the middle of a investigation in the Simmental breed of what they call Hydrops Pregnancies. These cows, as they get to mid-gestation, they start developing abdominal enlargement, much more severe than what you'd expect with just a full, well-fed cow that's pregnant. And sometimes it's enormous. We autopsied one of them that we bought and brought here so we could get samples from the calf, and there was 395 pounds of fluid in the uterus. So it's pretty amazing. And some of those poor cows, that all that weight will actually tear the abdominal muscles, and the calf will kind of drop. And if they don't do anything to intervene to induce parturition early, both the cow and the calf will end up dead. You can usually save the cow by early induction and get that calf out of there and drain the fluid. But it's a pretty devastating disease, and it's a challenge to work on because this one's unique. The first cases that were reported were from an embryo flush, where 2 of the embryos that were put into recipients had these Hydrops pregnancies. So that's kind of like, well, this is kind of weird because that happens from time to time. So it's a known condition in cattle, but here's 2 full sibling calves that had this pregnancy and unrelated cows. And the unique thing about I guess those cases were siblings, and then we started finding other reports of Hydrops pregnancies in Simmental cattle, and the donor dam in that first case and the other dams were all daughters of one particular sire. Huh. So we're like, well, maybe this is a sex-linked thing because it's just in these daughters, and we kind of started to pursue it that way because the embryo transfer cases were, of course, full sibs, but the other cases, they were all daughters of that sire, but the sires they were bred to were from a completely different line. So it's not a recessive trait, so it's a dominant gene action, but that sire and none of his sons have ever produced an affected pregnancy. Now, some of his sons have produced daughters that produced affected pregnancies, so there's an imprinting effect that comes from the dam that has to be there in order for the pregnancy to be affected, which is really making this a tough project for us because when we do these sequences, we have to have related individuals that don't have the genotype in order to sort it out. And it's real hard to tell which related individuals don't have the genotype. The only way to know for sure is if the cow has produced multiple pregnancies that were all normal, and even then it's kind of dicey. So it's been an interesting project, but it's really important to the breed because it's such a devastating disease.
Absolutely. How would you like to see people use the Veterinary Diagnostic Lab here at Nebraska and specifically continue to bring you ideas and things that are going on for your research?
Yeah, for the cattle to come in, the reports to come in, if it's in a purebred animal where you have pedigree data and stuff, it's usually best to engage the breed association. They might know right off what the disease is, that it's managed and can take care of it without getting me involved, and they'll refer it as necessary. If it's in a commercial operation, usually for animal diseases, I say the first point of contact is your local vet.
Yep.
And if he thinks there's a good reason to think it's genetic, they can contact me right when they're on the farm or beforehand and let me know. Otherwise, you can contact the Nebraska Veterinary Diagnostic Lab directly. You can search on the internet and get the phone number for the lab, or you can email the lab. When we have a generic email account that the secretaries check every day, where if you want to send a report or images, but most of the cases that we investigate come through the breed associations, and another advantage of going through them, if they're purebred animals, the breed associations sometimes, several of them have given me grant funding so we can do the investigations at no cost to you other than getting the calf to us or whatever the local vet would charge for the sampling.
Perfect. Thank you for what you do. Thank you for watching DocTalk. Remember, always work with your local veterinarian, and if you want to find us, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson, here with Dr. Dave Stefan, and we'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.